LimitX أمجد الشرفة. You can start, Amjad.
Assalamu alaikum. Hi everyone, thanks for joining us today. I will present for you our startup LimitX. So LimitX is an opioid risk intelligence platform that will give the medical facilities more visibility and control over high-risk medications. Once we talk about opioids, we are referring to a strong pain relief medication which is given in different clinical settings, which is like cancer or post-surgeries, and these medications is known as risk dependence once it's not properly managed. So the story behind LimitX, we are facing every day new cases in medical centers. I witnessed a wife requesting to stop the opioid chronic medication for her husband due to his absence or disengagement with the family. So today, opioids and controlled medication management is fragmented. Providers prescribe, pharmacists dispense, regulator audit, insurance pay, but no one can see the full picture of the patient risk in real time. This is causing misuse, causing medication diversion, doctor shopping, and we can see, based on WHO, we have more than 500,000 opioid-related deaths, and in the US only alone, they have spent $1.5 trillion on opioid treatment only. So LimitX is divided into three main components. The first one that will calculate the opioid exposure scoring based on morphine milligram equivalent, total opioid days supplied, overlapping, number of prescribers, number of pharmacies. And the second component will be using the NFC intake tracking that will calculate the behavior score. And the third component will calculate and combine the both scores together and will give us indicator if the patient reaching his maximum daily allowed or not. So how LimitX work? It starts by collecting and ingesting the data from the prescription and dispensing, and this all will come into a pool that will calculate the exposure score. And then the NFC medication intake tracking will give us the trend and will give us any like poor adherence, missed doses, overlapping. And at the end, we'll have the composite score that will calculate and combine the both scores together. And all this will be shown as a dashboard in all the stakeholders. So opioid safety, it's not only a clinical problem, it's also a global market opportunities. So for government, it will be a national opioid safety program, and the market size is $4.2 billion. For healthcare insurance, this will be used as reduced high cost for the claims. And in US alone, they have dispensed 125 million prescription only annually as an opioids. And for pharmacy networking, PBM, and clinical research, the market size is more than $700 billion. We have validated our idea with real stakeholders in the market. The medical director of Lumit Healthcare Services, Dr. Samar Abu Khalaf, he mentioned that this will be a strong opportunity to track patients more effectively, reduce medication abuse, and medication diversion. And also the Hadassah and Karim Penny Clinic consultant, Dr. Yunus Qawasmi, he mentioned that this will give them more broad review about the medication abuse due to the lack of communication between the medical centers and the hospitals. The revenue streams, if it is for the government, it will be as a platform licensing, per payers and programs, it will be per member or per patient. And also this can be implemented as NFC deployment or integration. We are asking for $100,000 to seek the seed round. This will be divided into 4 parts. For R&D, 40%, pilot validation, 30%, and 15% each for team expansion and regulatory compliance. This is our timeline for this year. We are targeting to complete the MPV within 3 months and continue by the end of the month to get the regulatory compliance and system readiness. Our team, myself, Amjad Shurafa, I have an experience for more than 20 years in health informatics and disease registry. Dr. Mamdouh Iskafi is an internal medicine and emergency doctor in San Joseph Hospital. And Sami Qar'in, he's our CTO as an AI consultant and system architect. So our vision that we need to have more access to the patient care, and we are moving and we are targeting to have more cooperation, and we are seeking providers, investors, and systems to implement and target the patient behavior. Thank you all.